Oregon. This is NBC 16 News at 5:30.
Governor Kate Brown announces a partnership with OHSU in a push to expand coronavirus testing across the state. Good evening and thanks for joining us for NBC 16 at 5:30. I'm Alan Matthews. Now this testing will start the Be the Key study. The state's testing goal has 3 parts. Let's take a look at that breakdown. First, officials want tests available for everyone showing symptoms. Second, they want testing for anyone living in group settings like prisons or senior homes. But it's the third part, widespread randomized testing, that the governor called a game changer. 100,000 Oregonians will be asked to join that study. They'll monitor their temperature and other symptoms every day for a year. If they show symptoms, they'll get a home test kit. 10,000 of the participants will also get tested no matter what to get data about asymptomatic infections. Invitations to join the study will be going out in the mail starting on May 11th. The governor stressed it is voluntary, but she asked Oregonians to participate if they are asked. The state has committed to an additional investment of $6 million for this study. The governor and OHSU are seeking more funding through public and private partnerships. It is a big day for hospitals and medical centers in Oregon. Elective, non-urgent surgeries have been given the green light by Oregon Governor Kate Brown. NBC 16's Tom Adams outlines what Eugene Springfield hospitals are doing in preparation and what patients can expect.
The COVID-19 fog is starting to lift finally from medical centers and clinics in Oregon. And for hospitals in Eugene Springfield, they are ready to once again offer elective surgeries.
Patients who have put off having back surgery or knee surgery, it's super important that they get in the queue and get operated on quicker.
Medical centers will follow the guidelines set down by Governor Kate Brown. And that means a slow increase in patients and prioritizing which cases go first.
The different practices and different providers are building a triage system for their patients, monitoring who has a condition that needs to be treated a little more urgently.
Hospitals must also keep 20% of their beds available in case of a coronavirus surge.
With all the work we've done over the last couple of months, have plans in place where we can quickly increase the number of beds available if there's a surge.
Staff at Peace Health's Riverbend Hospital are making final preparations to start elective surgeries on Monday. Mackenzie Willamette managers say they're set to go now.
We review our supply of personal protection equipment every day to make sure that we have enough for normal operations and then adding our surgery on top of it.
Managers say it's a good signal that Oregon is on the right path in fighting the virus and that the time is right to resume these surgeries.
But from a COVID perspective, we, I think, are prepared to take care of you in a COVID negative environment and make you as safe as we possibly can.
Reporting in Eugene and Springfield, I'm Tom Adams.
Governor Brown announced that some parts of Oregon may start reopening by May 15th. At a press conference today, public health officials announced whether Lane County would be one of those. Lane County's case count is still at 50 after a week with no new reported cases, but spokesperson Jason Davis says health officials haven't come up with an exact date to begin relaxing social distancing measures.
I will say that we have not sent any recommendations to our governor about our opening date yet. So I think what the governor was specifically referencing was counties who have already done that. So we would not be included in what she was referencing.
Davis says Lane County is still working on their blueprint to reopen. He says they will have more information on that after the county board meeting on Tuesday. It's been 1 week since National Frozen Food Corporation plant shut down after several employees tested positive for coronavirus. NBC 16's Stephanie Rothman tells us how Linn County Health Department is making sure workers stay safe.
The local Teamsters union tells us workers will be lining up here all day, awaiting to get back that negative test result, allowing them to get back to work.
8 workers and 2 family members tested positive for coronavirus, pushing the plant to pause production and test employees. The union says that number has grown. However, state and local health officials have declined to say how many workers have tested positive since, citing privacy concerns. Local Teamsters Union Secretary-Treasurer Michael Berenbaum tells me understanding how the virus is spreading among workers is the first phase towards reopening.
You have to test. I mean, one, it'll help put people at least at somewhat at ease, right? The downside to it is that all of this testing is a snapshot in time.
You're only finding out whether they're positive or negative today. It doesn't mean that they will remain negative.
But in order to find out, the rest of the national frozen food workforce, 270 people, need to get swabbed. In the meantime, workers stay at home, awaiting the green light.
People are still concerned, and now that they've known they've had this outbreak, some of them in their mind are saying, well, is the cleaning going to be enough? Is everything going to be enough, or am I putting my family more at risk now?
Teamster 670 is currently working to get special paid leave for employees during this time.
The hope is this day of testing gets them one step closer to reopening. As of right now, the plant still remains closed as they await these test results to come back. Reporting at Lynn County Fairgrounds, I'm Stephanie Rothman.
Meanwhile, on the coast, Coos County health officials confirm one of the inmates released from the Shutter Creek Correctional Facility back into Coos County has the coronavirus. Coos Health and Wellness staff say they were notified of the positive result and made contact with the former inmate yesterday.
Are working diligently with the individual to ensure that they follow the guidelines.
And they are following isolation guidelines.
Yeah.
The staff confirms the former inmate is self-isolating. They say the former inmate was asymptomatic and released on Tuesday after being tested over the weekend. Coos County currently has 21 cases, all inmates at Shutter Creek, including 2 employees. The first positive case at Shutter Creek was on April the 9th. Reopen rallies are being held across the state this weekend, including one in Coos Bay. The rally organizer says it's a show of support for all elected officials and representatives trying to reopen the state.
And opening up for the businesses, the hotels, for the restaurants, for all of them across the board. We would like to see a broader open up measures being put forth instead of this slow, methodical reopening that they're trying to put ahead of us.
Taylor says social distancing is up to those attending and that all workers are essential. They're gathering Saturday on the boardwalk at noon. One business person who plans to be there believes the response to the virus is overblown.
Financially, we're not hurt too bad, but I think there's a lot of people out there that I know personally that really need to get back to work.
Coos County public health officials do not recommend going to the rally, saying it will be hard to maintain social distancing, includes non-essential travel, and groups larger than public health would suggest. They say those who do plan to attend should wear proper personal protective equipment. Turning now to our map to break down the coronavirus cases across the state of Oregon. Oregon Health Authority announced 69 new cases and 1 new death, making that more than 2,500 cases and 104 deaths. Despite new numbers every day, less than 500 of those cases are people that are hospitalized, and the state keeps pushing to expand testing to reopen. In our region, the numbers do remain fairly low compared to counties in the northern part of the state. Benton County added 2 cases, bringing their total to 32 cases. Lynn County added another case, making that 87 cases. Here in Lane County, we remain at 50 cases for the 8th day now. Deschutes County has 76 cases. Douglas County broke a 2-week streak as it added a case and now has 24. Coos County stands at 21 cases, with cases breaking out at the Shutter Creek Correctional Institution. Mental health is one area that can be overlooked during this pandemic, so lawmakers and local nonprofits are combining forces and working on new proposals to come out of this crisis even stronger. NBC 16's Cassandra Gutierrez has that story.
In the midst of crisis, Whitebird Clinic is working even harder these days, helping meet the mental health needs of our community and expanding their knowledge and expertise nationwide.
Thursday, we had the opportunity to spend some time in a Zoom meeting with Representative Tlaib from Michigan, as well as State Representative Leslie Herod and Austin City Councilor Greg Caesar, to talk about different initiatives that are taking place.
Black says some initiatives include Representative Rashida Tlaib's proposal to Congress, called the Automatic Boost to Communities Act, or the ABC Act, pushing for several economic stimulus aspects.
But also included in that is the proposal to develop a national emergency first responder corps. And in that legislation, Rashida Tlaib is using Whitebird Clinic and Cahoots as an example of how community-based response without law enforcement, without fire and EMS services, can still be out serving the community and responding to crises.
Black describes the help and support geared towards communities nationwide during the pandemic is surreal.
What it really tells me is that in the midst of everything that's going on right now, folks are spending a lot of time talking about what's working and what isn't, and what we can do differently, how communities can work together to really support each other.
Black says one way the community can help is by checking in on their neighbors while respecting social distancing. He says Whitebird Clinic is doing what they can to support the community. If you would like to help, Whitebird Clinic says they are always accepting monetary donations, donated goods, and volunteer work. For more details on how to help or how to get help, you can visit their website. That's whitebirdclinic.org. For now, reporting in Eugene, I'm Cassandra Gutierrez.
Whitebird Clinic is accepting donations at their Eugene location on 12th Avenue. Coming up on your only local news at 5:30, with children spending more time on devices for at-home learning, parents need to be more aware of the material their kids may be seeing.